Did you know that one of the most inexpensive products in your kitchen may have more research behind it than many trendy wellness supplements? It's true. Baking soda, that simple white powder sitting quietly in your cabinet, has been studied for decades in medicine, dentistry, sports science, and even kidney care. Yet most people still think of it as nothing more than a baking ingredient or a refrigerator deodorizer. It costs pennies. It has no flashy label, no celebrity endorsement, no bold health claims printed on the box. And because of that, it's often ignored. Some health professionals have even described baking soda as one of the most underestimated household substances in modern wellness. But here's something very important. Just because something is common and affordable does not mean it should be used casually. Baking soda can be helpful in specific situations. It can also cause problems if misused. The key is understanding what it may support, what science actually says, and where caution is necessary. In today's video, we're going to walk through the potential benefits of baking soda one by one. We'll look at what research suggests. We'll separate tradition from evidence. And at the end, I'll explain clearly who should be especially cautious. If you're new to our channel, welcome. We focus on practical, balanced health information so you can make informed choices without hype or exaggeration. If that's helpful to you, consider subscribing so you don't miss future videos. And before we continue, let me know in the comments where you're watching from. I always enjoy seeing how wide this community reaches. Now let's begin. Supports the body's natural acid regulation. Baking soda is chemically known as sodium bicarbonate. It is alkaline, which means it can neutralize acids. Your body is constantly regulating acid and alkaline balance through your lungs and kidneys. In healthy individuals, this system works extremely well. However, in certain medical conditions, particularly advanced kidney disease, acid can accumulate in the blood. This condition is called metabolic acidosis. In controlled clinical settings, sodium bicarbonate has been used under physician supervision to help reduce acid levels in these patients. A well-known study published in Nephrology Research followed patients with chronic kidney disease who had metabolic acidosis. Those who received prescribed sodium bicarbonate experienced a slower decline in kidney function compared to those who did not. It's important to understand something here. This was not casual at-home experimentation. It was medically supervised supplementation with carefully monitored doses. For healthy individuals, the body already manages acid balance efficiently. There is limited evidence that drinking baking soda regularly provides detox benefits in otherwise healthy people. Externally, however, baking soda baths are widely used for soothing irritated skin. Many people report relief from itching, mild rashes, and skin discomfort when soaking in diluted baking soda water. While scientific evidence for detoxification through skin is limited, the soothing and pH balancing effects are commonly reported. Moderation and proper dilution are key. Supports oral health and surface stain removal. If you've ever brushed your teeth with baking soda, you may have noticed that your teeth feel especially smooth afterward. That's because baking soda works as a mild abrasive. It helps remove surface stains caused by coffee, tea, and certain foods. Many toothpaste brands include sodium bicarbonate because research has shown it can enhance plaque removal. Studies published in dental journals have found that toothpaste containing baking soda are often more effective at reducing plaque compared to similar formulas without it. Another advantage is its ability to neutralize acids in the mouth. Acidic environments promote bacterial growth that contributes to plaque buildup and gum irritation. By balancing pH, baking soda may support a healthier oral environment. However, this comes with an important caution. Because baking soda is abrasive, excessive or aggressive use can gradually wear down enamel. Most dental professionals recommend occasional use and always with a soft bristled brush. Used wisely, it can be a simple addition to oral care. Provides short term relief for occasional heartburn. Heartburn happens when stomach acid moves upward into the esophagus, creating a burning sensation. Because baking soda neutralizes acid, it has been used for generations as a fast acting antacid. Medical literature recognizes sodium bicarbonate as an effective short term acid neutralizer. A small measured amount mixed in water may provide temporary relief from occasional heartburn, but this is not intended for daily or long term management. Frequent heartburn can indicate underlying digestive conditions that require evaluation. Also, baking soda contains sodium. Regular use increases sodium intake, which may not be appropriate for individuals managing blood pressure or cardiovascular concerns. Occasional measured use may offer comfort. Repeated reliance should prompt medical consultation. Demonstrates antifungal activity in laboratory studies. Fungal organisms thrive in moist environments, especially on the feet. Laboratory studies have shown that sodium bicarbonate solutions can inhibit the growth of certain fungal strains under controlled conditions. This has led some individuals to use baking soda in foot soaks or as part of topical pastes for mild fungal irritation. While these methods may help create a less favorable environment for fungal growth, persistent or worsening infections require proper medical treatment. Baking soda is not a replacement for prescribed antifungal medications when those are necessary. May ease discomfort. During urinary irritation, urinary tract discomfort can cause burning sensations and frequent urination. Because baking soda can reduce acidity, some believe it may temporarily reduce burning discomfort by making urine less acidic. There are limited small studies suggesting sodium bicarbonate may provide symptom relief when used alongside medical treatment. However, urinary tract infections require proper diagnosis and often antibiotic therapy. Baking soda should never replace medical treatment. At best, it may serve as a temporary comfort measure under guidance. May help calm canker sores. Canker sores are small ulcers inside the mouth that can be painful. Because baking soda neutralizes acids and has mild antiseptic properties, rinsing with a diluted baking soda solution may help soothe irritation. Some small clinical observations suggest improvement in discomfort when sodium bicarbonate rinses are used regularly. It is inexpensive, widely accessible, and generally well tolerated when used appropriately. Enhances high intensity exercise performance. This may surprise you. Athletes have used sodium bicarbonate for years as a buffering agent. During intense exercise, muscles produce acid that contributes to fatigue. Sodium bicarbonate can act as a buffer, helping delay acid buildup. Meta-analyses published in sports science journals have demonstrated improved performance in short, high-intensity activities when sodium bicarbonate is used correctly before exercise. However, dosing must be precise. Too much can cause digestive discomfort, bloating, or nausea. This practice is typically used in structured athletic environments with guidance. May support kidney function in specific medical situations. Let's return briefly to kidney health because this is one of the most researched medical uses of sodium bicarbonate. When the kidneys are functioning properly, they help remove excess acid from the blood. But in individuals with advanced chronic kidney disease, this ability can become impaired. Acid levels may slowly rise, contributing to fatigue, muscle breakdown, and faster kidney decline. In controlled clinical trials, physicians have prescribed sodium bicarbonate to patients with metabolic acidosis related to kidney disease. The results were notable. Patients receiving supervised bicarbonate therapy often showed a slower progression of kidney function decline compared to those who did not receive it. Blood bicarbonate levels improved, acid balance stabilized, and the burden on the kidneys appeared reduced. But this must be repeated clearly. This is not a general wellness strategy for healthy individuals. It is a targeted medical intervention used under close supervision. Excess sodium intake in people with kidney issues can be dangerous if not monitored carefully. For those with kidney concerns, always speak with a healthcare provider before considering any form of supplementation. May influence inflammatory response in arthritis. Now let's talk about inflammation. Chronic joint discomfort, especially in conditions like rheumatoid arthritis, is driven by immune system activity. Researchers have been studying how sodium bicarbonate might influence immune signaling. In a 2018 study published in an immunology journal, researchers observed that sodium bicarbonate consumption appeared to shift certain immune cells toward a more anti-inflammatory profile in both animals and a small human sample. Markers of inflammation were reduced. Immune cell balance shifted. The inflammatory response appeared moderated. This does not mean baking soda cures arthritis. It does not replace medication or physical therapy. But the research suggests that the body's immune environment can respond to changes in acid base balance. If someone is managing inflammatory joint conditions, any addition to their routine should be discussed with a healthcare provider first. May help manage gout related uric acid levels. Gout occurs when uric acid accumulates and forms crystals in joints, often causing sudden and intense discomfort. Because uric acid is influenced by body pH, alkalinizing agents like sodium bicarbonate have been studied for their ability to increase uric acid excretion. Some clinical findings suggest that alkalinizing urine may help reduce uric acid crystal formation. In theory, this could reduce flare frequency or severity. However, gout management typically includes prescription medications and dietary adjustments. Baking soda should never replace these treatments. Also, excessive sodium intake can create additional risks, particularly in individuals already managing blood pressure. When used occasionally and with medical guidance, it may serve as a supportive measure, not a primary treatment. May help soothe cold and upper respiratory irritation. During cold season, throat irritation and congestion can make daily life uncomfortable. Baking soda is sometimes used as a gargle. When mixed with warm water, it creates a mildly alkaline solution that may help soothe throat irritation. Its ability to neutralize acids and reduce microbial presence in the mouth has been observed in dental research. Some studies suggest that alkaline mouth rinses may reduce throat irritation and microbial load. Additionally, baking soda is occasionally added in small amounts to saline nasal rinses. This can help adjust pH and make the solution more comfortable for some users. It's important to emphasize that this does not treat viral infections directly. It may simply support comfort and hygiene during recovery. May play a role in ongoing cancer research. This is an area that requires very careful language. Cancer cells are known to create acidic microenvironments around tumors. Researchers have explored whether altering tumor acidity might influence cancer cell behavior. In animal studies, including one widely cited experiment, sodium bicarbonate was used to alter tumor pH in mice. The results suggested reduced tumor acidity and changes in tumor progression. However, these findings were preclinical, meaning they were observed in laboratory animals. There is currently no established recommendation for baking soda as a cancer treatment in humans. More clinical trials are required. It is essential that anyone undergoing cancer treatment consult their medical team before considering any supplements. Baking soda is not a cure, it is an area of ongoing research. Functions as a natural deodorant. Now let's move to a more everyday application. Body odor occurs when sweat interacts with bacteria on the skin, producing acidic byproducts. Because baking soda neutralizes acids and absorbs moisture, it can reduce odor when applied topically. Studies in cosmetic dermatology have shown that sodium bicarbonate can reduce underarm odor when used appropriately. Many people use a small amount under the arms, sometimes mixed with coconut oil. However, skin sensitivity varies. Some individuals may experience irritation. Always test a small area first and discontinue use if redness or discomfort develops. Who should be especially cautious? Now we need to talk about safety. Baking soda contains sodium. 1 teaspoon contains over 200 milligrams of sodium. That is a significant amount. Individuals with high blood pressure should be cautious. Those with kidney disease must avoid unsupervised use. People with heart conditions should consult a physician. Anyone managing fluid retention needs guidance. Pregnant or nursing women should speak with a healthcare provider before internal use. Individuals with stomach ulcers, gastritis, or chronic digestive conditions should be careful, as altering stomach acidity can sometimes worsen symptoms. And inhaling baking soda powder can irritate the respiratory tract, particularly in those with asthma or breathing conditions. Moderation is critical. More is not better. Understanding proper use and dosage. One of the biggest mistakes people make with simple household remedies is assuming that because something is common, it must also be harmless in any amount. That is not true. Baking soda is powerful specifically because it alters pH, and any substance that changes your body's chemistry needs to be respected. When used occasionally and in small amounts, baking soda is generally considered safe for most healthy adults. But large or repeated doses can disturb electrolyte balance. Too much sodium can lead to fluid retention, increased blood pressure, stomach discomfort, bloating, muscle cramps. In rare cases, very high intake can cause serious imbalances in blood chemistry. That's why most medical references emphasize that baking soda should be used sparingly unless prescribed and monitored by a physician. If using for occasional heartburn, only small measured amounts should be taken, and not repeatedly for chronic symptoms. If using as a mouth rinse, it should be diluted properly. If using topically on skin, it should be tested on a small area first. The key principle is simple: minimal effective use. Why baking soda works the way it does. To understand why baking soda shows up in so many health conversations, we need to understand what it actually does at a chemical level. Sodium bicarbonate reacts with acids to produce carbon dioxide, water, and a salt. In the stomach, that reaction can temporarily neutralize excess acid. In the mouth, it can balance acidic conditions that contribute to plaque. In sweat, it can reduce odor by neutralizing acidic compounds. In athletic performance, it can buffer acid buildup in muscles. In kidney disease, it can reduce acid levels in the bloodstream when medically indicated. Notice a pattern? Nearly every potential benefit relates to pH balance. But here's something important to remember. Your body tightly regulates pH. It does not easily allow dramatic shifts. In healthy individuals, attempts to alkalize the body through diet or supplements have limited systemic impact. That means baking soda may influence localized environments like the mouth, stomach, or urine more than it changes your overall body chemistry. This is why exaggerated claims online can be misleading. There is science, there are benefits, but there are limits. Traditional use versus modern research. Baking soda has been used in traditional home remedies for generations. Before modern pharmacies were common, people relied on accessible household ingredients. Baking soda was widely used for soothing insect bites, relieving mild skin irritation, cleaning minor wounds, freshening breath. Modern research has validated some of these uses, especially in dentistry and sports science. Other uses remain more anecdotal. This does not mean they are ineffective. It simply means they have not been studied as extensively. In wellness conversations, it's important to separate tradition from scientific validation without dismissing either. The problem with miracle cure thinking. One reason baking soda has generated controversy in some circles is because it has occasionally been promoted as a miracle solution. That is not accurate. It is not a cure all. It is not a replacement for medical treatment. It is not a substitute for healthy lifestyle habits. Baking soda can be supportive in certain contexts, but real health is built on balanced nutrition, regular physical activity, adequate sleep stress management, medical guidance when needed. No single kitchen ingredient replaces that foundation. Practical, responsible ways to use baking soda. If you're considering incorporating baking soda into your routine, here are practical guidelines. For oral care, use occasionally, not daily. Mix with toothpaste or dilute as a rinse. For heartburn, use small measured amounts only for occasional relief. For skin soothing, dilute properly in bath water or create a mild paste. For odor control, apply lightly and test for sensitivity. For any internal use beyond occasional antacid relief, consult a healthcare provider. Consistency and moderation protect your health. When to avoid it entirely. There are situations where baking soda should be avoided unless specifically prescribed. If you are on a sodium-restricted diet, if you have uncontrolled high blood pressure, if you have heart failure, if you have advanced kidney disease, if you are taking medications that affect electrolyte balance, always disclose supplement use to your healthcare provider. Even something as common as baking soda can interact with medications or underlying conditions. Let's bring this all together. Baking soda is one of those rare substances that sits quietly in the background of everyday life, yet has a surprisingly broad range of researched applications. It has been used in hospitals as an antacid, studied in kidney care under medical supervision, included in many toothpastes for plaque removal, used by athletes to buffer muscle acidity, applied topically to reduce odor and soothe skin. That is quite a resume for something that costs so little. But here is the most important takeaway. Baking soda is not powerful because it is magical. It is powerful because it is chemically active. It changes pH. And anything that changes pH must be used carefully. When used occasionally and appropriately, baking soda can be a helpful tool. When overused or misused, it can create problems, especially because of its sodium content. So the question is not, is baking soda good or bad? The better question is baking soda appropriate for this situation in this amount for this person? That mindset protects your health. If you are a healthy adult and you use baking soda occasionally for heartburn as a mouth rinse or as a deodorant, it is generally well tolerated. If you are managing kidney disease, heart conditions, high blood pressure, or fluid retention, you should never experiment without medical guidance. If you are considering internal use regularly, speak with a healthcare professional first. Simple does not mean risk-free. Affordable does not mean unlimited. Now let's talk about something else that matters. Why are ingredients like baking soda often overlooked? Because they are not profitable. There is no marketing campaign around them, no influencer promotions, no expensive packaging. Yet sometimes the most useful tools are the least glamorous. That does not mean they replace modern medicine. It simply means they deserve balanced attention. Used wisely, baking soda can support comfort in certain situations. Used carelessly, it can disrupt balance. The difference is education. And that is why conversations like this are important. Before we finish, I'd love to know, have you ever used baking soda for anything beyond baking? Was it for heartburn, oral care, skin soothing, something else? Share your experience in the comments. Your story may help someone else learn. And if you found this video helpful, consider subscribing. We focus on practical, research informed health information without exaggeration or fear based claims. Thank you for spending this time with me. Remember, real wellness is not about chasing miracle cures. It is about understanding your body, respecting balance, and making thoughtful choices. And sometimes the simplest tools used correctly can quietly make a difference.